Assalamu alaikum. Today we're going to talk about setting of the lower anterior teeth in this video, and the video later will be talking about setting posterior teeth. For setting anterior teeth, we have to check that the lower wax rim is totally clean, because we want to make sure that it's totally flat and its relation with the upper teeth are correct. Then we check the upper. We put the upper on the glass slab. We make sure that all of the rules of setting apply. So in terms of which cusp is touching, which is not, the angulation of the roots, and angulation of long axis of teeth, curve of Spee, curve of Wilson, all of these features that have been present in the upper, we recheck them according to the previous video that you have seen. And then we put the teeth back, and we make sure that the relations we have seen on the glass slab are also present in the wax. Because if the wax is not touching, if you had a problem with the wax touching, you will have the rules not applying. So anything we have on the glass slab in terms of tooth contact and angulations, we should have them on wax. Now we're going to check the midline. So as we told you in the first video, that we are going to use cast-to-cast midlines as reference for your training to overcome any problems with the articulator or any problems in your clinical skills in determining or drawing the midlines on the wax. And second, because the wax will be molten, so we will lose the midline on the wax. So we make sure that our reference for the midline is the cast-to-cast relation. Now we're going to begin setting the teeth. For adding the teeth, we're going to follow the same rule as we did in the upper, where we are opening boxes. For each tooth, we're going to open a box. We're going to open around the midline, mesial to the midline. And as we said in the upper, where we told you that please set two central incisors together to make sure that we observe the midline or preserve the midline. We're going to open the box for one central, add it, and then add the other central on the other side. So we're opening the space for the first lower incisor. For the setting of the lower, make sure that you don't mix teeth together because they look very similar. So the midline on the set of teeth that you have is the midline where teeth are set to the right or to the left to it. So make sure you do not mix teeth up, because lower central incisors and lateral incisors are very close in morphology. So make sure that you take the correct tooth out, and it is the first one to the midline, right to the midline, and we're going to place it into location. And here we're going to observe all rules of setting. That includes the inclination of the root and the position of the incisal edge. So after opening the box, we make sure we do not remove too much wax. We melt down the area beneath the tooth, and then we place the tooth in its position. We're going to place the tooth 1 to 2 millimeters above the occlusal table on the wax rim. The reason for this, we're going to do what we call an overbite. So what is an overbite? It's having the lower teeth bite in a higher position than the incisal edges of the upper teeth. So they are biting from the inside surface. Now, if we place the tooth in the wax rim, exactly on the wax rim height, we will not get an overbite. We create overbite by having the tooth set into location a bit higher than the wax rim itself. When each tooth added, we make sure that we have its angulation correct from the beginning, not to do a lot of adjustments. It's better to have the angulation. The root of the lower is tilted to the inside, and the incisal edge is to the outside, so we just press on the root area. We make sure that the inclination of the tooth is correct, and now we can compare it with the upper teeth. Okay, what are we comparing here? We're comparing the position of the tooth to create what we call an overjet. So you can see clearly that the lower tooth is going upwards more than the incisal edge. It's coming into close contact with the upper, but not actually touching. There should be a space. There is an overjet, there is an overbite, but there is a very minor space in between the two teeth. The lower should not be touching the upper. We'll try to focus on it and show you the overbite. Okay, so now we could go on and set the other tooth. We also shouldn't compare the midlines together. So we go back to our reference. Our reference was cast to cast midlines. So we need to make sure that the midlines of the lower and the upper are correct in the setting. Now we go to the second lateral incisor. If you want to be sure about the midlines, as we told you in the upper, you can place two central incisors together to make sure that the central incisors are on the midline. So here we are opening for the other central incisor. Okay. Fixing the tooth in place by melting the wax around it. When the wax is molten around the tooth, it will become soft and it will be more adherent, so it fixes the tooth into place. Now we're taking the other central incisor because we want to observe and preserve the midline. So we put it according to the same rules of setting, which is 1 millimeter above the occlusal plane. The roots are depressed, and then once into location, we use molten wax and we begin filling in the spaces between the teeth, fixing it into location. And while it's still warm, we compare it with the upper. So if we need any adjustment, we can simply just adjust it in the warm wax we have. So we compare it with the upper, overjet and overbite. This tooth, we cannot compare it because we have the wax in, but if the tooth was there, we should have an overbite with the upper tooth. Okay, what we need to concentrate on is the midline. So what we are looking at, that the midline between the both incisors is corresponding with the midline of cast to cast area. Okay, this is how we adjust teeth in location. We simply just move them while they are in the side the wax. To make sure that the midlines are coinciding, we use a ruler in between, connecting the upper midline with the lower midline, and as you can see, that the midlines are coinciding with each other. The upper central and the lower central are coinciding. Now we're looking more close at the overjet and overbite. So the overjet means that the incisal edge of the lower is more back than the upper incisal edge. And the overbite means that the lower incisal edge is higher than the upper incisal edge and it goes to the inside. But this does not mean they touch. We have an overjet and overbite with an empty space in between these two teeth. So we have an overjet and an overbite without any touch. We will explain this in the lecture talking about setting rules for anterior teeth. Now we're going to add the second incisor, lateral incisor. So once more we open a box, a bit short than the length of the tooth. And while working, we need to make sure that the tooth is stable in position. Then we melt the wax beneath. We're melting the wax beneath the tooth. We're taking out the correct tooth. So after we have removed the other central incisor, we just made the central incisor to ensure the midlines. Now we're adding the lateral incisor. Now the lateral incisor has, when you set it, you need to set it distally inclined. The root is distally inclined. The root itself is depressed into the wax. The incisal edge is more prominent to make the labial inclination, to produce the labial inclination of the tooth. The tooth should become in contact with the other, with the central incisor, and the overbite and the overjet are still applicable. And notice that when you look closely, that the overjet should be parallel between both teeth. Okay, so the overjet that we have created should be parallel between upper and lower teeth. This is how we move teeth in their location. We can adjust the position of the tooth, adjust the position of the root. And make sure that all inclinations are correct, and recheck them on the upper. We also fix the tooth from the lingual side, making sure that we have enough molten wax going around the tooth and around the interdental papilla area to fix it in place. Notice that for the lateral, this overbite had closed the space left by the upper lateral incisor. Remember, when we put the upper lateral incisor, we made it 1 millimeter away from the occlusal table, half to 1 millimeter away. So when we did the overbite using the lower lateral incisor, we have closed the space. Now we're going to add in, after finalizing the position, we're going to add in the canine. One of the rules for setting lower anterior teeth is that we should have the incisal edges all straight, central, lateral, and distal of the canine straight with one piece. Taking that the incisal edges are straight, the roots are not. The roots have different positions. They have different angulations. Slight distal angulation for the lower central, more distal angulation for the lateral, and more distal angulation for the canine. How do I determine how much do I angulate it? It easily can be determined by the incisal position itself. If I want this incisal position straight, I could not get it if this tooth is tilted to the side. Okay, so if I'm going to put it here like this and going to observe the incisal edge, I would not get a straight incisal edge, the incisal edge straight, unless the tooth is angulated in this direction. You can see that the distal angulation of the tooth here is more. If I'm going to put the lateral into location and I want the incisal edge straight with the central, I will not get it straight if I adjust it or put it in this angulation. The teeth are designed that if you put them in the correct angulation, they will automatically have an incisal edge straight. Okay, so our guide, different tooth molds have different morphologies, but the idea is that when I have the incisal edges straight, I will have the roots in the correct angulation. So this will determine the angulation of the tooth, having the roots divergent in a degree that is enough. When I place the canine with them, the canine is distally angulated, but how much do I angulate it? It's determined by the distal surface of the canine. I angulate it in a way. If I'm going to angulate it like this, for example, okay, this has shifted the angulation, so I'm going to readjust the lateral to be straight, central should be straight, and the canine, I'm going to adjust it in the angulation where I have the distal surface of the canine going with the line that we had. So this will not apply unless I put the canine in this angulation. So this is straight, this is now straight. And with the distal surface of the canine. So they are all on one line incisally. Okay? Okay, so now we're going to add in the canine. So we're going to apply the same rule we talked about, having the incisal edges together. These two teeth that we added are now together, but now we're going to add the canine in. So we open a window for it. And it's important here to have the teeth fixed into location, because lower teeth are thin and they can easily move in wax. So sometimes you are aiming to add one tooth, but you end up moving the other teeth after you have already added. So we're trying to melt the canine position. Make sure that we have enough window for the canine to be added with a distal inclination. So we're concentrating first on putting the canine edge with the incisor edges and in the correct distal inclination, and then we slightly rotate it to the inside because we want it also to follow the arch here. Okay, so if I place it like this side, but after I make sure that the incisor edges are together, I rotate it to the inwards to make sure that it's within the arch that we're working with. And which arch would we follow? We're going to follow the upper arch. So I'm going to, after adding and correcting the position of the canine, I'm going to finalize its position, comparing it with the upper. So I melt from the buccal side and from the lingual side. I make sure that the tooth is first secure. And at the same time, this melting will soften the wax beneath it, so I could move the tooth easily into location and correct its angulations. So I'm putting the tooth into location and then comparing it with the upper. I should have the same overjet that I had. So if my overjet, if the tooth is touching the upper members, I should not have it. Now the lower canine should have the same overjet that the centrals had, the same overbite that the centrals have, and also it should come into location between the lateral and the upper canine position. So the width of the lower teeth are less than the upper teeth. The upper teeth are more wide. So the position of the canine correctly, to be correct, it should be in between the space mesial to the upper canine and distal to the lateral incisor. And this is the setting of the lower anterior teeth. And you may begin doing the other side as well for this level. So we're going to just look at them in a final view. You may notice that the midlines are together, comparing the upper cast midline with the lower cast midline. And of course these should have been straight when you have done the mounting. So the mounting itself should have been the midlines all together. We also have the central incisor, the lower central incisor with a slight distal divergence of its root, the lateral incisor a bit more divergent, and the canine more towards the distal. These are the roots locations. The prominence, there is a prominence for the root of the canine, while these are depressed, making the tooth inclined labially. But if we open and see the incisor relationships, these should be straight on one line with the distal of the canine. And when we put the upper and the lower, we can see that the overjet, the space between the upper and the lower, are equal from the inside. Notice that the overbite that we had, which is 1 to 2 millimeters, is closing the space that we had beneath the lateral. Do you remember that the lateral was not on the occlusal table? So the amount of overbite of the lower have reduced and eliminated any space appearing between the two laterals. And you can see that the canine is located between the two laterals. We're going to talk now about how we're going to do the quality check for the upper setting, the setting of the upper teeth. First of all, when we do these quality checks, we do them at an early stage while we're doing the setting. We don't wait until we have the full arches set and then we begin adjusting tooth by tooth. It's preferred to begin this work at the beginning. Whenever you add a tooth, make sure that these rules apply. So what do we check when we are working? Although we're setting using a glass slab, and at all times we are adding the base plate, we're putting the base plate on the glass slab. And we're checking according to this glass slab the relations. But we want to note that the glass slab is representing actually the lower wax rim, because when we began setting, we made sure that the upper and lower wax rims were in total contact. So whenever I add a tooth here, make sure you go back and put the base plate on the articulator, close it, make sure that the pen is still on the table, touching the table, and the wax rims are still in contact. If we don't have the wax rims in contact, what might have happened that we have set one of the teeth in the upper jaw high. So we need, whenever we're setting, to go back and check the other side of the wax is total contact and the pen is touching the table. So this is the first check we do. I also check the midlines. So we can bring a ruler and check that the midlines, the cast to cast midlines are coinciding with the teeth. We have not, the incisal pin should have been used in the articulator, but you might have some problems with your articulator. We just want to make sure that the cast to cast midlines are coinciding. This is how we mounted the casts in the beginning, and they should be coinciding with the midline of the pin and the midline of the jig in the beginning where we have mounted. So all of these lines coincide, but sometimes looking far away from the incisal pin to the teeth will sometimes cause some confusion, so it's better to put something closer to the teeth and compare it with. So we are checking the midlines are correct. Then we check that our setting is inside the incisal arch, the arch lines. When we set teeth, the teeth position are determined by many reference points. We had the incisive papilla with a canine line explained in the lecture. We have that the anterior teeth should be 8 to 10 incisal edges of the teeth are 8 to 10 millimeters in front of the incisive papilla. For this we can use an incisive papillometer. But we also can check using vertical view on the cast in this direction that the teeth are not outside the base plate. So if we look vertically down in this direction, we should see that the arch of the teeth are with the arch of the base plate in the same line. So we don't go away, especially in the anterior area. In the molar area, we are allowed to have 1 or 2 millimeters inward movement of the teeth. The palatal cusps of upper teeth are coinciding with the lower ridge crest line. So if this is the lower crest, if we come closer and compare the position of the crest with the palatal cusp, we find that the cusps are over the center line over the crest of the ridge. So this is the crest line. If I can just, by the pencil, draw, let the pencil run over the crest, and this is the crest line. So the palatal cusps of the upper are over this line. We also have other reference lines, are the lines of lateral lines. So we have the arch line in the anterior area, we have the tips of the molar, canine, premolar, and molar on one line, we call it mid-buccal line, and then we have the posterior line where we have the cusps of the molar, mesial distal of the second molar, all are in one line, so this is another line. So these are called reference lines. We also have the, if you can look closely at the central fossa of the teeth, the central fossa of the teeth are all in one line. So let us revise those lines on the drawing here. So we always compare our setting with the lines. We have external lines, and we call this is the arch line of the anterior teeth. The teeth from canine to canine should follow this, the setting of the teeth should follow this line and be not more in terms looking at it. I could also notice that if I'm taking this out and even invert it and look at it from the side, when I see this is the sulcus recorded in the base plate, none of the teeth are appearing from behind the setting. So the teeth are set inside that arch line. The second line is this midline, canine, premolar, and molar all on one line. We call this mid-buccal line. We call the final line posterior buccal line. It joins the mesial and distal of molar cusps in one line. So while we're setting the teeth, we take the teeth inwards slightly. We have the central lines later. And then after we had talked about the external lines, the line joining the fossa together is called midline of the fossa. And we have the line of the palatal surfaces of teeth all together. So although these are on two planes, the lines palatally should be the same. So all the teeth should be aligned palatally correctly. And the cusps of the upper, palatal upper cusps in these areas, the tips of the cusps, not the palatal outline, but the line joining the tips of each cusp of the upper is coinciding with the lower crest line. So if we invert this is the upper going down on the lower. We find that the palatal cusps of the upper are aligned in a way over exactly the mid of the crest of the lower. So this is our lines, reference lines. So after checking the base plate on the articulator, then looking at it from an occlusal view, now we're going to look at it in frontal and buccal views. So we're going to look and observe the occlusal plane. The occlusal plane is represented here on if the lower articulator, if the articulator is present, what we call the occlusal plane is the plane where the upper meets the lower, and we call it an occlusal plane. Okay, so this line is called the occlusal plane. If I take the cast or the base plate outside the articulator and put it on my glass slab, now what represents the occlusal plane now is this glass slab. Okay, but whatever I am doing here, once I finalize the teeth position on this occlusal plane, I go and check it back on the articulator. So what are we looking in comparison with the occlusal plane? First of all, I have to look in front. This is the frontal view of teeth. When I want to look at them, I want to see that the midline is coinciding with the midline of the cast. The central incisors are placed on the occlusal plane perfectly. And once they are in this direction, we need to look at their angulation also in a moment. But let us just concentrate first of all which tooth is touching, which is not. So when I'm going to correct your work, I'm going to say centrals should be touching, laterals should be a bit higher. So you can notice that the lateral is higher by 0.5 to 1 millimeter. So if I'm looking at the lateral is not touching the glass slab, it's higher by 0.5 to 1 millimeter. And if I'm putting in the canine as well, when the canine is in, the canine is touching. So which teeth are touching the occlusal plane? So central is touching, lateral is higher than the occlusal plane, canine is touching. Now we go to the buccal view, looking at the teeth from side. The canine is touching, the buccal cusp of the premolar is touching, the palatal is not, should not be touching. The second premolar, both cusps are touching, For the first molar and second molar, both are not touching except the mesiopalatal of the upper. If we look from the inside, we're looking from back. If I look from this side on the occlusal, if I'm looking from this side on the occlusal plane, I'm looking from the inside, I should see the first premolar not touching the glass slab. The second premolar palatal cusp is touching. For the 6, the only cusp touching is the mesiopalatal. The distal cusps are higher in occlusion to create what we call curve of Spee. So curve of Spee begins from tooth number 6. The mesiopalatal is touching. We go up and up and up to the 7. These cusps are all in one line when we set the teeth. So whenever you're setting the molar on the glass slab, suppose this is the molar. Whenever we set the molar on first molar on the glass slab, we first put 4 cusps on. But then, when we want to shift, we shift distally, we raise it distally to make the curve of Spee, and then we raise it buccally to create what we call curve of Wilson. So the molar plane is curved distally and buccally. So if I'm looking from the buccal view on the molar, I should see part of the palatal cusps by the curve of Wilson, and the only cusp touching the occlusal plane should be the mesiopalatal. So revising, central is touching, lateral is not, canine is touching, buccal of the first, both cusps of the second premolar, and the mesiopalatal only of the molar are touching the cusp. Once we finalize which cusp is touching and not touching, we go back and check the angulation of teeth. For example, this central incisor can be touching while it's like this or like this or like this. So we need to look at the long axis. What is the long axis of the tooth? We also call it midfacial line. It is the line bisecting the tooth. It goes from the middle of the incisal edge to the middle of the cervical outline of the tooth, of the crown, the clinical crown. So this midline for the central incisor should be shifted by a degree to the right, around 5 degrees. So we don't place the central long axis of the tooth upright. We slightly rotate it distally. Once we achieve this, the incisal edge will be flat on the occlusal plane. If we put it upright, you will find that the mesial of the tooth is touching, the distal is raised. So automatically, when you incline the tooth in the correct inclination, the incisal edge becomes horizontal with the occlusal plane. The lateral, for the lateral, it's tilted more to the distal, more than the central, around 10 to 15 degrees. So it's more tilted to the distal. The canine has 2 options. You can put the canine upright. I'm looking now between buccal and frontal view. I'm looking directly at the canine. I have 2 options for setting up the canine. I have the first option where I could put it upright, or I could tilt it slightly distally. So 2 options for the canine setting. The premolar is upright. Both premolars are upright. But then the molar and the second molar are a bit tilted to the mesial by putting them into curve of Spee, because the tooth is not flat on the occlusal plane. We have raised the distal. This makes the tooth slightly angulated mesially in the molar and the second molar. So if this is this side, it's tilted towards the mesial. This is what we call the long axis of the tooth. Once we have this finalized, one last point is the root angulation of the teeth. If I look closely at the teeth, in the root angulation, I find that the central should be tilted labially a bit. The root is depressed. So if the incisal edges are on the arch lines that we explained, the external arch line, the roots are not in the same level. So we depress the root of the central slightly. We depress the root of the lateral even more. We make the root of the canine up, and this is the canine upright. So the root is prominent. The lateral is depressed. The central is a bit prominent. So to produce what we call labial inclination. So this is the central. This is the lateral, even more inclined. We're talking about the root, not the long axis here. We're looking at the proximal view, and this is the root position, and the root is depressed more. And once we place the canine in, we make it prominent. And if we look at it from the frontal view, we have this prominence of the canine. So this is how we judge your work. So let's revise the work. First, let's go through all points. We first judge the work on the articulator, the pen is touching, the occlusal plane is flat, and it's the wax are touching each other. And the other side, we have the midlines coinciding. Then we take the upper out. We judge the external arch lines. We take a occlusal view, judge the external outlines, the arch, the mid buccal, and the posterior buccal lines. We compare the palatal line. We compare the cusp line, the palatal cusp line with the lower. We compare the incisive line. So we have multiple lines to compare occlusally. Then we put that work on the glass slab, and then we compare the contacts, which tooth is contact and which is not. Then we judge your angulation of the teeth, and then judge the root position of the teeth. And once you have all that finalized, you will have your setting correct. Thank you. So to judge your work, we will have 4 tables with 4 technicians there, and each technician will have 2 criteria to judge. Once you have had an approval for your work from all 4 tables, you are ready to come in and submit the upper and begin with the setting of the lower. So please follow the approval sheet that you will get and have distributed for you. Thank you.